Long before modern hospitals, advanced technology, and scientific breakthroughs, humanity faced disease, injury, and death with little more than instinct, observation, and belief. In ancient times, illness was not always seen as a physical condition. It was often believed to be the result of curses, angry gods, or unseen spiritual forces. Across civilizations, from the deserts of ancient Egypt to the temples of ancient Greece and the vast lands of ancient China, early healers walked a fine line between science and mysticism. They experimented with herbs, minerals, and natural remedies, discovering treatments that would later form the foundation of modern medicine. Yet they performed rituals, chants, and spiritual ceremonies to drive out supernatural causes of disease. Some treatments were surprisingly effective, using honey to prevent infection, or plant extracts to reduce pain, while others were dangerous, involving toxic substances or extreme procedures. Without knowledge of bacteria, viruses, or anatomy as we understand it today, these early practitioners relied on trial and error, often risking lives in the process. And yet, despite these limitations, ancient medicine achieved remarkable progress. Surgical tools were developed, wounds were treated, and medical texts were written, documenting knowledge that would be passed down through generations. What makes this era so fascinating is not just the struggle against disease, but the ingenuity and determination of people who refused to accept suffering without a fight. They observed patterns, learned from nature, and slowly began to separate myth from reality, laying the groundwork for the medical science we depend on today. This was a time when healing was both an art and a mystery, where every cure carried risk, and every success brought humanity one step closer to understanding the human body. And as we explore the world of ancient medicine, you'll see that even without modern knowledge, early civilizations were far more advanced than we often imagine, proving that the roots of modern healthcare stretch deep into a past filled with experimentation and survival. In the ancient world, few civilizations were as advanced in the art of healing as ancient Egypt, where medicine was not just a practice, it was a highly organized system that blended observation, experience, and spiritual belief into something remarkably ahead of its time. Egyptian physicians, often considered the world's first doctors, developed specialized roles, with some focusing on specific parts of the body such as the eyes, teeth, or stomach, an early form of medical specialization that would not become common again for centuries. Their knowledge was carefully recorded in texts like the Ebers Papyrus, a detailed document containing hundreds of remedies, diagnosis, and treatments for a wide range of conditions, from wounds and infections to digestive disorders and mental illnesses. What makes Egyptian medicine truly fascinating is how it combined practical treatment with spiritual understanding. While they believed that illness could be caused by supernatural forces, they also demonstrated a surprisingly scientific approach, cleaning wounds, stitching injuries, and using natural substances like honey for its antibacterial properties and moldy bread. Surgeons performed procedures using tools made of bronze, and evidence suggests they understood the importance of hygiene and bandaging. Their experience with mummification also gave them a unique familiarity with the human body, even if their understanding was limited by religious beliefs. Yet, not all treatments were effective. Some remedies included magical spells or strange mixtures that reflected their spiritual worldview. Still, despite these limitations, Egyptian medicine laid critical foundations for future medical systems, influencing Greek and Roman practices. What stands out most is their determination to understand the human body and combat illness in a time when knowledge was scarce. They were pioneers, experimenting and passing down knowledge through generations, transforming healing from mere superstition into a structured discipline. And as we look back today, it becomes clear that the roots of modern medicine do not begin in laboratories or hospitals, but in the ancient temples and scrolls of Egypt, where the first true doctors began humanity's long journey toward understanding life and health. In the ancient world, a revolutionary shift began to take place in the understanding of health and disease, a shift that would forever change the course of medicine. In ancient Greece, healing began to move away from superstition, magic, and divine punishment, and toward observation, logic, and rational thought. At the center of this transformation was one of history's most influential figures, Hippocrates, often called the father of medicine. Unlike earlier healers who attributed illness to angry gods or evil spirits, Hippocrates proposed a radical idea that diseases had natural causes and could be studied, diagnosed, and treated through careful observation of the human body. This marked the birth of a new approach: medicine as a science rather than a belief system. Greek physicians began documenting symptoms, tracking the progression of diseases, and studying environmental factors such as diet, climate, and lifestyle. They introduced the concept of the four humors: blood, phlegm, yellow bile, and black bile, believing that health depended on the balance of these bodily fluids. While this theory was not entirely accurate, it represented an important step toward systematic thinking and diagnosis. Perhaps one of the most lasting contributions of Greek medicine is the ethical foundation it established. The Hippocratic Oath, still echoed in modern medical practice, emphasized responsibility, integrity, and the duty of doctors to do no harm. Greek doctors also emphasized the importance of patient care, recommending rest, proper diet, and natural treatments. This focus on observation and reasoning laid the groundwork for future medical advancements, shaping the scientific methods used today. What made this transition so powerful was the belief that the human body could be understood through knowledge rather than fear. In a world dominated by myth, ancient Greece dared to ask questions and seek evidence, setting humanity on a path toward medical science. While other ancient civilizations focused on physical symptoms or divine causes of illness, ancient China developed a completely different approach, one that viewed the human body as a system of balance, energy, and harmony with the natural world. At the heart of this system was the concept of qi, the life force believed to flow through every living being. It connects the body, mind, and environment into one unified whole. Illness was not simply a disease to be removed, but a disruption in this natural flow of energy. This was often caused by imbalance between opposing forces known as yin and yang. Restoring health, therefore, meant restoring balance. Ancient Chinese healers developed practices such as acupuncture, where fine needles were inserted into specific points to regulate the flow of qi. They also used herbal medicine, using carefully selected plants, roots, and minerals to support the body's natural healing processes. These treatments were based on centuries of observation, creating one of the oldest continuous medical traditions in the world. Texts like the Huangdi Neijing laid out detailed theories about anatomy, diagnosis, and treatment, emphasizing prevention as much as cure. Chinese medicine focused heavily on maintaining balance to avoid disease altogether through diet, exercise, and breathing techniques. It recognized that health depended on the harmony of body, mind, and the environment working together. Even today, these practices continue to be used around the world, influencing modern wellness and conventional healthcare. True healing is not just about treating symptoms, but about restoring balance within the entire human system. Thousands of years ago, in the ancient lands of ancient India, a powerful and deeply philosophical system of healing emerged: Ayurveda, a practice that viewed health not just as the absence of disease, but as a perfect balance between the body, mind, and spirit. Unlike many early medical systems that focused only on symptoms, Ayurveda approached healing as a complete lifestyle. Every individual has a unique constitution, known as doshas: Vata, Pitta, and Kapha, which govern physical and mental characteristics. According to this system, illness occurs when these internal energies fall out of balance, often due to poor diet or stress. To restore harmony, Ayurvedic practitioners developed treatments combining natural remedies with daily routines, emphasizing prevention as much as cure. Herbal medicine played a central role, with plants, oils, and minerals carefully selected to rebalance the body. Therapies such as detoxification, massage, meditation, and controlled breathing were used to cleanse and strengthen both body and mind. Diet was considered medicine itself, with specific foods recommended or avoided depending on an individual's constitution and condition. What makes Ayurveda remarkable is its holistic vision. It recognized that mental health, physical health, and lifestyle are deeply interconnected. Ancient texts like the Charaka Samhita and Sushruta Samhita documented detailed knowledge of anatomy, surgery, and pharmacology, showing a level of sophistication that continues to impress today. Even surgical techniques were practiced with surprising precision. Despite its ancient origins, Ayurveda remains widely practiced today, influencing wellness trends and integrative healthcare systems globally. Its enduring legacy lies in a simple idea: that true health cannot be achieved by treating the body alone, but by understanding the delicate balance between the physical, mental, and spiritual aspects of human life. Ayurveda stands as a reminder that sometimes, the oldest wisdom still holds the deepest truths about healing and well-being. As the power of the Roman Empire expanded across continents, so did its approach to medicine: practical, organized, and deeply focused on efficiency. Unlike earlier civilizations that blended healing with heavy spiritual beliefs, Roman medicine took a more structured and results-driven path, heavily influenced by Greek knowledge but refined through real-world application, especially in one critical area: The military. Roman armies were among the most disciplined forces in history, and to maintain their strength, they developed advanced medical systems to treat wounded soldiers quickly and effectively. Field hospitals, known as lutenaria, were established near battle zones, equipped with surgical tools, trained physicians, and organized care remarkably similar to modern military hospitals. Surgeons performed procedures such as amputations, wound stitching, and removal of foreign objects like arrows, often with surprising success given the limitations of the time. But Roman innovation didn't stop at treatment, it extended into prevention, which became one of their greatest contributions to medicine. Understanding that disease could spread through poor living conditions, the Romans invested heavily in public health infrastructure. They built vast aqueduct systems to supply clean water to cities, constructed complex sewage systems like the Cloaca Maxima to remove waste, and designed public baths that promoted hygiene among citizens. These advancements dramatically improved living conditions and reduced the spread of disease, showcasing a level of awareness about public health that was far ahead of its time. Roman doctors also emphasized cleanliness in medical procedures, using clean instruments and bandages to reduce infection, an approach that would not be fully understood again until centuries later. What made Roman medicine so effective was its practicality. It focused on solutions that worked, systems that could be replicated, and innovations that benefited entire populations, not just individuals. Even though their understanding of disease was still limited, their emphasis on organization, sanitation, and structured care laid the foundation for many aspects of modern healthcare systems. Today, when we think of hospitals, public health policies, and sanitation infrastructure, we are, in many ways, witnessing the legacy of Roman innovation, a civilization that understood that true medical progress was not just about curing illness, but about creating a healthier society as a whole. When we think of surgery today, we imagine sterile operating rooms, advanced tools, and precise medical knowledge, but thousands of years ago, ancient civilizations were already performing complex and often dangerous surgical procedures with surprisingly bold skill. Across regions like ancient Egypt, ancient India, and ancient Greece, early surgeons developed techniques that laid the groundwork for modern surgical practices. Even without anesthesia, antiseptics, or a full understanding of human anatomy, one of the most astonishing procedures was trepanation, the act of drilling or cutting a hole into the human skull, believed to relieve pressure, treat head injuries, or even release evil spirits. While it sounds terrifying, archaeological evidence shows that many patients actually survived these operations, with skulls displaying signs of healing. In ancient India, the physician Sushruta described detailed surgical methods in the Sushruta Samhita, including early forms of plastic surgery, such as reconstructing noses using skin grafts, a technique remarkably similar to procedures used even today. Meanwhile, Egyptian doctors used bronze instruments to stitch wounds, set broken bones, and perform minor operations, often applying natural substances like honey. Greek and Roman surgeons further refined these techniques, developing specialized tools and emphasizing observation and technique. Despite the lack of modern pain management, some forms of sedation were used, including herbal mixtures that dulled pain or induced sleep. What makes ancient surgery so remarkable is not just the procedures themselves, but the courage and innovation behind them from both healers and patients.